If I asked a group of expectant parents what they are most afraid of when it comes to labour, quite high up that list will be pain. Now, it's not trendy to call contractions painful anymore. Many people prefer terms like surges, but it's also causing a lot of guilt when labour starts and you feel like you really need some help managing the contractions. So whether it's your first baby or your fifth, understanding your options for pain relief can help you to feel more in control and prepared for that big day. So I'm Brooke, an obstetrics and gynaecology doctor. Let's talk about the different ways to manage pain during labour, from the early stages all the way through to delivery. So first, let's think about some options for early labour. Now, these methods of pain relief can help you to stay comfortable and calm as your labour begins, and even to help it to progress. So warm water can be incredibly soothing. Warm bath or shower can be used at any point in labour. You might find it helps to distract you from the pain. Some people even give birth in the water. However, just because you use the water during your labour doesn't mean you have to have a water birth. Next up, paracetamol, or acetaminophen, if you're watching from the US. It's a common over-the-counter medication or pain relief, and it's safe to use this in pregnancy. It's actually quite a good idea to try to take 2 paracetamol in early labour, and if you're starting to feel some discomfort from those contractions. If it does take all the pain away, you're probably not in labour and these are more practice contractions, or they're just not quite there for established labour yet. However, if it just takes the edge off but you continue to experience the kind of discomfort with the contractions, it may well be labour building up. Either way, taking that paracetamol is helpful to help you to maybe stay at home that little bit longer and help give you an idea about whether it is actually labour. If you are wondering how you would know if you are in labour, you can check out my last video. Hypnobirthing is another excellent technique. It involves deep relaxation, visualization, and focusing your breathing to help to manage pain and anxiety. Hypnobirthing can allow you to feel a sense of control, as you can focus on the parts of the process that are within your control. It encourages you to consider how to optimize your environment, such as the sounds that you're hearing, so whether you want to hear music or calming songs, or just some positive affirmations playing out loud, voice notes from family and friends, for example. Also think about what you can see and what you can smell. Arranging, again, positive words of affirmation like each contraction is bringing me closer to my baby. Putting those on the walls around your birthing room can help to bring you some comfort. If you're interested in trying hypnobirthing, there's many great books and courses, both online and in person. And it can also involve listening to some guided meditations, guided affirmations, even during your labour. And they can actually be used even if you're having a C-section. You might also consider using a TENS machine. This sends small electrical pulses through pads that are placed on your back. They can help to reduce your pain. You can often hire these devices, and you can use it at home or on the labour ward or in a birth centre. It works by distracting your brain, by giving competing impulses to dull that sense of pain that you might be experiencing. Acupuncture can be performed by a qualified practitioner and can also be effective in helping you to manage early labour discomfort and even to help to encourage the onset or the progress of your labour. But of course, that depends on you having access to someone who can do acupuncture nearby. So now let's think about which options are just available to you when you get to a hospital or birth centre. So we'll think about gas and air. It's also known as Entonox, and it's a mixture of nitrous oxide and oxygen that you inhale through a mask or a mouthpiece during the contractions, similar to when you go to the dentist. It's fast acting, and it can take the edge off the pain without staying in your system for too long. And the pros are it's easy to use, you get to control it, and it doesn't affect your baby. I liked it myself because it was something to focus on. Because you hold that mouthpiece in your mouth and you take a deep breath in and out through the same mouthpiece. It can focus your breathing as you're going through that surge. However, some people do feel a bit dizzy or nauseous or just find that it's simply not enough to help take the edge off for them. Again, you can have that anywhere. So you can have that in the maternity triage areas where you're being assessed, on the labour ward, on a birth centre, or even in a home birth. A lot of the midwives are able to bring it to your house. Moving on to the medical forms of pain relief, so you've got options like diamorphine or pethidine. So these are opioid medications. They're given by injection into the muscle. They can help you to relax, and they do reduce the pain. They're very effective for pain relief, but they do come with some pros and cons as well. So the pros, as I say, they're very effective pain relief, and they can actually help you to completely rest and relax because it takes that pain away and lasts for around, say, 4 hours. However, they do cause drowsiness. That can be a nice thing if you want to get some sleep, but they can also cause you to feel nauseous or even a bit dizzy or a bit out of the room, and they do cross the placenta. So for this reason, we don't recommend you have these injections close to when we're expecting you to deliver your baby. So if you're like 9 or 10 centimeters dilated. And this is because if your baby is born within an hour after the injection, they also might be a bit drowsy or less responsive temporarily. It's because that medication is crossing the placenta, so they're getting the same side effects as you. Side effects are temporary, they wear off with the medication, but it can be difficult for the doctors to work out when the baby's been born if the cause of their drowsiness is because of the medication, or if because there's actually something else going on with the baby, they've got an infection or something else, and that's why they're not responding. And so it might lead to more interventions for the doctors to be able to check your baby's well-being. So if you're earlier in labour, these effects will have well worn off by the time the birth happens, and it can be a fantastic pain relief option. Next up, one of the most well-known forms of pain relief is the epidural. So this involves having an injection of a small amount of local anaesthetic in your back, followed by a stronger anaesthetic that's injected into the epidural space that's around your spinal cord. It provides excellent pain relief, and when you have that injection, they actually leave behind a little tube into that space, which allows you to get further top-ups of the anaesthetic medication. So the pros of having an epidural are it offers very good effective pain relief, and it also can be adjusted, so it can depend on your preference how much pain relief you want or how little. You can be completely numb from your toes all the way to the top of your bump, or you can stay quite mobile and just have a little bit of pain relief depending on how many doses that you receive. Main downsides are that there are risks of anything, and it's beyond the scope of this video to give you all of the risks of having an epidural anaesthetic. Some risks to be aware of is you can get severe headaches. The epidural sometimes might not work the first time it's placed, it might have to be replaced multiple times. And there are more serious temporary or permanent effects like a loss of movement or paralysis in your muscles. If you're concerned or you want to talk more about the risks of epidural, definitely ask your doctor to go into it in more detail for you. Also, an epidural might not be an option for everyone. For example, if you've got certain blood clotting conditions, you may be told that you can't have an epidural in labour. So therefore, if you want to have an epidural, definitely discuss it with your medical team earlier on in your pregnancy so you can have a good think about the risks and the benefits. Now, sometimes you might be wondering what's the difference between an epidural and a spinal anaesthetic. Well, an epidural involves a small tube being left behind, as I already mentioned, whereas a spinal anaesthetic is just a one-off injection, so you can't have any further top-ups with it. The spinal injection is actually into the spinal fluid. It's a slightly different location to when you have the epidural, but from your perspective, it feels more or less like the same thing. Spinal anaesthetic will give you a good strong pain relief for around 4 hours. So it's often used, for example, for a cesarean section. It acts very quickly, it gives you a really strong block, and it then will wear off when it's no longer needed. So spinals are good for short procedures, whereas epidurals can be used if you need to maintain that anaesthetic block for longer. So for example, throughout labour or for a more complicated procedure. Is it ever too late to get an epidural? Well, generally, you can have an epidural at any time during your labour, as long as you are able to maintain the position for the anaesthetist to safely insert it. It's important to be aware that it can take some time from when you actually get the medication inserted for it to become effective. So if your baby's born within 10 minutes of having the epidural inserted, you may not benefit from the pain relief itself. So sometimes you might be told it's too late. And that's not that the doctors or the midwives being mean. It's to say that if you have the epidural when the baby's head is genuinely about to be delivered, you won't get the benefit of the pain relief, and actually it's a bit more risky because you may be moving about more. Otherwise, you can of course have one at any point that it's safe for you to do so. Can you push properly if you've got an epidural? Well, yes, the good news is absolutely you can. Whilst the sensation for pushing might be a bit different, you might not be able to feel exactly where you need to direct that pressure towards, but most people can still effectively push, and your midwife can help to guide you for where you need to put the pressure. Some people choose to allow the epidural to wear off slightly as they're reaching that pushing stage, but it's not strictly necessary unless you want to. So there you have it. So a whistle-stop tour to some of the pain relief options that you might have heard of that you could have during labour. If you want me to go into any one of those in more detail, just let me know and I can make more videos. Ultimately, the most important thing is that you discuss your preferences with your healthcare team and they can make a plan that feels right for you. So thanks for watching, and do let me know, leave a comment below if there's anything else that you'd like me to cover.